Hello, my name is Dr. Adil. I'm one of the emergency consultants at Armourdale Hospital. And the purpose of this video is to show you a typical journey of a patient when they present to emergency department at Armourdale Hospital. So let's go inside. This is our ED. It is from here that we provide urgent medical care 24/7, making sure you get the help you need whenever you need it to achieve the best possible outcomes. Whether you are facing a severe injury, a sudden illness, or a critical condition, our dedicated team is ready to assist you. Your health and safety is our top priority, day or night.
Some patients walk into the waiting room and some patients arrive by ambulance. When you arrive at the emergency department, you will be triaged. During triage, our clinical staff will gather basic information and details about you and your condition. This process involves a quick assessment to prioritise patients based on the severity of their conditions. It ensures that those who need absolute immediate life-threatening attention receive it promptly, allowing us to provide the best care in critical situations. Next, you'll go through a registration process where our clerical staff will update your patient details. Our goal is to make sure that everyone gets the right level of care as quickly as possible. As I'm sure you can appreciate, we simply cannot see everyone at the same time. As you settle into our waiting area, please know that wait times can vary based on the urgency of each patient's condition. We prioritise those who need immediate attention. The ED has an ambulatory care area where patients requiring a lower level of care will transition through. Please note, this means that sometimes patients who arrive in ED after you will be seen first. This process ensures that the ED flows smoothly and that everyone receives the appropriate level of care required. Our patients range from the elderly to pregnant women and young children and everyone in between. To make your wait more comfortable, we can, depending on your condition, sometimes provide pain relief and anti-nausea medications within the waiting area. Your comfort and understanding are important to us as we work to provide the best care possible for you. Whilst we try and accommodate a relative or support person within the main ED, space is limited in the ambulatory area and patients, based on the nature of their illness or injury, are typically requested to move through this area on their own. If you have a medical or psychological need to have a support person in this area, please let the staff know and we will do our best to accommodate. If you have specific cultural or disability related needs, please let our staff know and we will do our best to accommodate these also.
During your medical evaluation, you will first meet with a nurse who will ask you about your symptoms and medical history. This step is crucial. Your honesty is very important, providing the accurate information to help us understand your condition that will help us to tailor the care you receive. Afterwards, you will meet a doctor who will conduct an assessment on you. They may ask you more questions and perform some tests to determine the best course of treatment. The more information we have, the better it is for us to make an assessment on you. The information you provide is kept confidential, just like any visit to any doctor. This teamwork between you and our medical team ensures you receive the most effective care possible.
During your evaluation, you may undergo common procedures or tests such as blood tests or X-rays. These help us diagnose your condition accurately. We understand that some tests may be unsettling for you, but rest assured we prioritize your comfort and have pain management options available to make the experience as smooth as possible. Some patients may be asked to sit in the waiting area whilst these tests are processed. Please touch base with our staff if you feel that the results are taking longer than was indicated to you. Typically, it takes about 1 to 2 hours for the results to be received.
We're a team of allied health professionals, including physiotherapists, occupational therapists, and social workers. We're here 7 days a week to assist you on your journey through the ED. We may ask you questions and look at how you're moving.
Our Aboriginal health team provide culturally safe, secure clinical liaison and advocacy services for all Aboriginal and Torres Strait Islanders community members and families. Accessing healthcare at Gadjangara, Armourdale Hospital and Kalamunda Hospital, We aim to support members of the Aboriginal community throughout the entire hospital journey and make their experience as positive and caring as possible. Some of the tasks that the team may help with include assisting patients and families to navigate the hospital system, explaining a diagnosis, outlining treatment options and medical procedures. Our role is to also support patients attending scheduled appointments to receive the treatment they need. If you are an Aboriginal or Torres Strait Islander person in the hospital and would like to have someone from our team by your side, please don't hesitate to ask if we don't find you first.
We understand that ED can be a confronting and sometimes unsettling place to be in, and that the wait times can sometimes be frustrating. But please remember, everyone is trying to do their best to ensure everyone gets the best possible care in a timely manner. The staff are here to help you. Please treat our staff and others with respect and courtesy. For everyone's safety, the ED, including the waiting area, is monitored by CCTV. Any form of verbal or physical aggression will not be tolerated and may result in police being called.
Please do let us know if you have concerns around your own safety, so measures can be put in place. A social worker can meet with you to discuss your concerns confidentially and provide support while you're in ED.
At Armidale Hospital, we are conscious that you know yourself or the person you care for the best. Therefore, you should never hesitate to use the Aishwarya Care Call phone in ED or personally speak to a staff member in the area to highlight or elevate any concerns. The phone is there for patients, carers and family members to use if they are worried they or a person they care for is getting sicker while in hospital and their concerns are not being addressed.
After your treatment, you'll consult with the doctor to discuss your results and the next steps. The discharge process will include clear instructions about your care at home, including any medications you may need to take and details about follow-up appointments.
If you're going home from the ED, we may organise referrals to community and outpatient services for ongoing treatment, preventative care or services at home to keep you as safe as possible and aid your recovery. If your visit to the ED is out of our work hours, your nurse or doctor may refer you to us so we can follow you up after your visit to see how you are managing at home.
The Older Adult Liaison Service is a nurse-led initiative. We work closely with teams within the emergency department, including geriatricians, to optimise the care of frail and vulnerable older adults, usually over 65 years of age. Our role includes promoting patient-centred discharge, improving links with community care, communication with primary care providers, and promoting self-care and chronic disease management. You may be referred to a nurse-led clinic to support your safe discharge for further assessment where admission is not required.
Thank you for taking the time to listen to this video. I hope it gives you a better picture of the patient journey through the emergency department here at Armidale Hospital. Please reach out to a member of our wonderful team if you have any questions or queries regarding your care. We love to hear your feedback. Get in contact with the Consumer Engagement team and provide us with feedback as we're constantly striving to improve our care. I wish you a swift recovery.